in the CTS 713, which is titled as the Discipline of Scientific and Grant Writing. This course of 713 is divided into 4 components. Two components are related to scientific writing and 2 components are related to grant writing. I will be talking to you on scientific writing, whereas Dr. Thankam will be talking to you on the grant writing. Among those 2 components, the first component is the theoretical knowledge, which I will be presenting to you today, showing you some slides, and I will be happy to answer any questions regarding that. The second portion is an assignment. An assignment is to write the scientific writing. And I will propose to you a few topics in the end of my lecture today and give you an options of 9 to 10 topics, and you can select one. And those assignments will be due at the next lecture, maybe 2 or 3 weeks or so. If somebody wants to take a little longer, that's okay. But we would like you to have in such a way that we can publish it into a some paper publications with your name as the first author. Any questions before I start? If no question, let's get going. So as I told you that I will be talking to you on the scientific writing only, and Dr. Thankam will be talking to you on the grant writing. As you all know, I don't know how many of you have already published a paper, already have some experience of writing or not. But nonetheless, some of you might have it, some of you don't. So some of this will be very superficial for you, but it's worth refreshing your memory regarding the best practice of scientific writing. As you know, in scientific writing, there are so many different components in there, and we have to take care of all various components in such a way that they are very effectively conveyed in your paper. So the key principles of scientific writing are the main 4 principles are that it has to be very clarity in your scientific writing. It has to be concise. It has to be very well organized with the proper structure of your scientific writing. And also whatever you present, it has to be accurate with objectivity. This is utmost important because whatever you are presenting, you have to maintain the proper record of this in case there is any question or any audit on what you have published. Sharing a knowledge with other audience is a responsibility, and also having a name in any published articles is a big responsibility, because whatever words are written in your paper is your responsibility to answer any questions. And especially if we are funded from NIH or other federal government or even the state government one, then we are subject to audit at any time with the findings which we report. So it has to be very accurate and objective. That is why in my last lecture, I emphasized about maintaining all the data, raw data as well as the calculated data in a very proper manner. So good writing communicates an idea or the findings clearly and effectively. So that is the major goal in there. Good writing starts with clear thinking. So you have to really develop your thinking before you start writing any article in there. And before you do that, as I emphasized last time, that sometimes you may be collaborating with your colleagues or other investigators, it is always a good idea to discuss that in advance about who will be the first author, who will be the second author, and so on. And as well as while the time comes to write your article, it's a good idea to divide the sections, that who will be responsible writing what sections in there. There is a challenge in that aspect. The challenge is that the flow may not be the same because each one has a different style of writing. But nonetheless, that portion comes while you are finally editing your article before submitting to a journal. But it is important to discuss that in advance, that which portion of the article will be written by which author. The primary author is the main responsible person, and sometimes we write the first two authors as with the same contribution. And this is also possible if first two authors have contributed the same amount of work in the published findings. So, authorship, discuss it within your team. This is utmost important. Sooner the better you discuss that who will, the order of the authorship and who will be responsible for what. This is important. Writing is a process. Good writing does not happen overnight. It requires planning, drafting, rereading, revising, and editing. And it really requires self-review, peer review, subject matter expert feedback, and practice. And there are no shortcuts. Practice makes perfect. So the way we always do that, we have a first draft, and then it undergoes the second draft, third draft, fourth draft, depends upon how well the draft is written. And then only comes to the final product, which is ready to submit to a journal for publication. So in case of this academic writing or scientific writing, you have to be concise. You have to come to the straight to the point. Try use the third person, no I or we in there. Keep the sections organized. Keep it unbiased and backed by the evidence. Whatever you are reporting in there, whether you're finding, then you have to back it up with your raw data and all the data available if needed. But also, if you are reporting somebody else's finding, then you should really read their paper very carefully before you cite them. Sometimes what happens that after paper is published, we get a call or an email from the published author that you have not properly cited our article. So it happens, but try to be backed by the evidence and read the citations very carefully before you mention it in your article. And give proper citation. If you are referring to somebody's work, then you need a proper citation. You have to be formal. Once you are publishing a scientific article, it has to be a formal. Not too fancy, but it has to be a formal. There is a subtle difference between the science writing and scientific writing. As shown in this particular slide, that in the case of scientific writing, which you will be doing, it has to be specific, professional, geared to a specific audience. And you sometimes we use some jargon, but try not to use too much jargon in your scientific writing and use the formal language. And you have to give the details, whatever you are writing, especially in the section of the methodology, and we will talk about it. And then in the scientific writing, the IMRAD section format is the one which is important. And IMRAD means that introduction, methods, results, and discussion. So this becomes important. And on the right-hand side are written the parts of the science writing, which is different than the scientific writing. So it is important to be sure that scientific writing is geared to a specific audience. Try to avoid too much jargon, and also it has to be in a certain format. Before you start writing, then you have a lot of data in front of you. You are wondering how to summarize it in an effective manner. And that is the art of doing a good scientific writing. And we all learn with our experience. In my experience here working with the students in the last 45 years, first time once they are writing, it is a little bit challenging for them. But once they have done the first article or second article, it goes a lot easier for them to write the next article. So it all depends upon how much motivation and how much dedication you have and how much interest you take. And again, emphasizing having your authorship in an article is a responsibility. So IMRAD, the format is explained in this one. It's very simple, that this is the whole sections of your article, scientific article. It starts with the title. And title is the brief, informative, and readily searchable by a person or a machine. This is important. You have to select your title in such a way that you are indeed explaining about that particular aspect which is mentioned in the title. I receive many articles to review for various journals, and several times it happens the title speaks such a flowery manner that it does not really tell too much within the manuscripts. So many times I ask them to change the title, or I reject the article because it does not talk about the exact aspects which was the main objective of the work. So it is important that you have to select a very good title which you are indeed examining in your paper. Then you have to write an abstract. An abstract is just what is it in a nutshell. And this abstract is generally we write within 200 to 250 words, starting with a little background, one or two sentences on the key methodologies, and then the main highlights of the results and the main highlight of your discussion and interpretation. Everything within 200 to 250 words, and depends upon the journal you are submitting. Next section is the introduction. So why did you do it? And that starts with the background on the subject. You give what is the background, what is the etiology, what is the epidemiology, and what are the incidences, and what is the importance of the work which you are doing, and what is known so far, what people have reported, and based on that, what is not known, what are the gaps in our knowledge. So what are the outstanding questions? And then you mention about your hypothesis of your work. Hypothesis, objectives, or the goal of your work. So that is a part of the introduction. And then you have to come to the study site, that where did you do the study? It is important. It has to be written in there clearly, whether it was approved by a particular ethics committee of your institution or not. And the methods, you have to explain in details. If you are talking about animals, you have to talk about all different aspects of the animals, whether their sex, age, and any other conditions, which you have to mention how they were housed in the vivarium, what type of feeding they were given, and what you were doing while they were in the experiment. So you have to describe about those. Then you have to describe in methods about that what are the various techniques you have used. If you have used the cell lines, what is the source of those cell lines? Give the numbers of those cell lines. And then how did you culture them? How did you maintain them? What was their purity? How did you isolate them? And all that information you have to explain. And then various technologies, various techniques such as Western blotting, PCR, any cell culturing, anything else, whatever you are doing, you have to explain that in the methods very clearly. And in the method section also comes the statistical analysis, that how did you collect the data and how did you analyze it? And I will come to some of those points later. Then you describe the result section, where you summarize the findings with the headings and informative figures. Don't do the discussion here. Just mention what you found, and then with the very detailed information on your findings. And the discussion, don't mention it here. It has to be in the discussion section. And then in discussion section, what does it mean? And so what? And explain your results. and whether your objectives were achieved. How do your findings correlate with the published findings in the literature? And if they do not, what are the potential regions of discrepancy? You have to come up with those. And it can be due to the different methods you are using, different type of patient population you are using, and different other conditions you are using. So all those things, or sometimes the comorbidities may really come up with the different findings and results. So all those things you have to explain in the discussion section. And also you have to say that what are the limitations of your work? Sometimes there is not enough number of samples in there, or some other limitations you have to mention. What are the gaps in our knowledge left? And how do your findings help in advancing our knowledge in that field? And finally, you have to give conclusions in terms of the significance of your work, major findings and significance. And then you have to have acknowledgement and also the references. So these are the major sections of any scientific research paper. So again, it is shown very simple way in here that you have to research topic area, you have to discuss, and then hypothesis, test with experiment, analyze the area, report conclusion and observations, and any outstanding questions you have to discuss in there. So more or less, it is like in the methods, you have to provide a cookbook so that anybody can pick up your work and want to repeat it. They can exactly do the similar studies, see whether they find the same results or not. That is the whole idea behind this. That is why we have to give it is like a cookbook with the all ingredients which you have used. And that is why NIH requires mentioning all the numbers, catalog numbers, as well as the numbers of your cell lines and all details. And which company did you purchase it from? Did you test whether those antibodies were really correct antibodies or not? So all that information they wanted to do so that if anybody wants to pick up, they will use the same ingredient and trying to repeat your experiment to see whether they can reproduce it or not. It's really important. So again, in the methodology, clear and correct information on all material and resources, including experimental animals, sex, age, cell lines, chemicals, reagents, anything you are using in your study. You have to really give a proper. If you are cutting a section, what size of section you are cutting, what microtome you are using, how are you staining them, and all that information you have to mention. Then replicates, that how many replicates of each sample you are using in your experiment, how are you analyzing your data. Replicates are not the same as the N value. N value refers to the sample size. It is not that one tissue you have done 3-4 replicates and you are now have a sample size of 4 or 5. That is not correct. Sample size is still 1 because those are only the replicates. Replicates are the one that how reproducibly you get the data using the same sample. Accordingly, we have to have a proper sample size. And why do we need the proper sample size? This is required for proper statistical analysis. And how do you come to the sample size? You do it a power analysis. Alpha, beta, you already know those things, that what is the power you want, how much variation between the various subjects or various samples you will be expecting, and what is the minimum difference you are looking for. So all those parameters you have to put it into the power analysis to come to the proper sample size for making a decision based on the statistical analysis you are doing. And when you are reporting that, then you have to report the mean value with standard deviation or standard error of means and with the appropriate sample size. Then you have to perform a proper statistical test. And depending upon the type of experiment you are doing, it could be between the two samples, the t-test, which could be paired or unpaired. And if it is a multiple groups, then you have to do ANOVA, which could be one-way versus two-way ANOVA. And also, you have to decide the type of statistical analysis you will use, and that could be based on whether there's a normal distribution in there, or otherwise you will use the non-parametric statistics in there. So all those things you might have already learned in your previous theoretical work, but now you have to apply this while you are performing your experiments and reporting your data. Any questions so far? Okay, so next section comes the result section. That how do you really present your research findings? Provide context for the data, bringing all of the data sets together to form a cohesive body to ensure all results directly relate to your objectives or questions. Provide regions that drove to generate the data set. Explain why specific parameters or variables in the experiments were examined. Provide level of details for sufficient evidence, but don't be too overwhelmed with that. Readers should be able to understand the core evidence. It's a very good idea to use tables, figures, and charts to summarize data and make it easier to understand. And keep the result section focused on reporting findings and save interpretation for the discussion section. Don't use the discussion within the results section. This is the practice in most of the journals. There are few journals, they want you to write results and discussions together, and then it's a different thing. But when it's the only results, then don't include the discussion in your result section. Just summarize your findings and what you found. So tables and figures, make them self-explanatory. What does that mean is that you have to write a proper legend to the figure or legend to the table to explain what you are showing in the table or figures. If you are using abbreviation, always mention below in the legends that what does this abbreviation mean. And this should be that if somebody sees your one figure or one table, it should be self-evident, self-informative that what you are conveying in that particular table or figure. This is important. So once you have done those result section, then what to do? Then comes the major portion of the discussion section, where in the initial one, you will be summarizing the findings with the key discoveries, provide insights on how the results align with the research question, discuss and connect your findings with the published reports, discuss if your findings do not support the published information. So here comes the challenge to think about why my findings are not the same as another person. This could be due to the different variables due to the subject size, variables due to the type of subjects, variable due to the comorbidities, variables due to the some other conditions or study design, and all those things you have to come up with in here. That is why it is important to point out in your methodology all various things which you are doing in the methods are very well explained so that the other person can correlate their findings with your findings. Discuss theoretical and practical implications of the findings. It is also critical to point out the constraints, challenges, and limitations of your research, and then provide gaps in our knowledge and future directions. This is always a good practice to think yourself that how my findings advance the science in that area, what are the still gaps left in that particular area, what needs to be answered in the future. It's always helpful. So in the end, you have to really look into the limitations. Many times, some journals do not allow you to present all of your raw data, all of your findings. So they allow you to submit as an appendix. So some of the very low-hanging data, which is not very critical, you can submit in your appendices. But the main data related to your main objective or hypothesis must be present in your article. But also acknowledge the limitations as mentioned in here. After that, have a section of acknowledgement. In my last lecture, I mentioned to you that there might be some people who might have given you some idea, something, but did not significantly contribute towards the actual science or the actual work, that they did not earn the authorship in your article. But you have to mention their contribution in the acknowledgement. If your work is supported by funding, then you must report it. Hey, by the way, whenever you report any findings of your work this summer, I think there is a certain language you have to specify. You have to first say that I was supported by NIH, NIAID, R25, R and such number funding for this research work. I will ask Netley to send you that language again. I know in the contract we have written something, but I forgot to mention that in any publication coming out of this work, you have to mention that I was supported that such and such, whosoever participant says, is the Viho, Alia, Hiva, Felicia, anyone. Just write that supported by in the summer research program, number such and such by NIAID. And the work is report, and we will send you the actual language, which you have to mention in the end. Conflict of interest. You have to mention in there that if there's any conflict of interest. Any support in writing. Did you seek anybody's help in writing your article? And also it's important to mention that all authors have read the article and consented to submit this for publication. And this is important, as I mentioned earlier, that having a name is a responsibility. So each author must see the final product before it is submitted to a journal. Then comes the reference section. Always go back to the original source. Many times what happens that some people just cite a reference based on somebody else has cited that reference in their article. Don't do that practice. Many times we have seen that the citations in some other articles could be wrong, and you don't want to see that happen in your article. So always try to go to the original source of the citation before you cite in your own article. It's really important. Reference and styles, as you will see in PubMed, there are 4 different types of reference styles are shown in here. And these are the styles: LML style, AMA style, APA style, or MLA style. And you can really have the citation directly from PubMed in any of these styles, depending upon the journal you are submitting your article. I prefer using LML, the very first one, NLM style. And if the journal wants to change it, they can change it after we submit the article to them. But that's the one which I prefer. And that's the way I submit most of the articles. It's all your choice. But these are the 4 different styles and very easy to cite the article from PubMed. So in summary, the key points in scientific writings are sentences and paragraphs. Simple sentences to convey complex information. Don't have long paragraphs. Try to write the short paragraphs. Use the correct verb tense. In the abstract, present tense for theory and conclusions, and past tense for experimental results. In the introduction, present tense for theory, past tense for scientific methods and findings of previous research, and future tense for hypotheses. In the methods and results, past tense, because you already have done it, so that is why you will be using the past tense in the methods and results. In the discussion section, past tense for results of your study, that we found this, we observed this. And present tense for relating results to other findings or theories. For example, the findings in this study are consistent with or collaborates with such and so on. So that's the way you will be writing your thing in your paper. Try to use the active voice compared to the passive voice. Active voice always give the much better, clear message. For example, I wrote the manuscript instead of the manuscript was written by me. We found it versus it was discovered. However, you may use passive voice if it conveys the information more effectively. Always use the correct word. Be precise. Simplest words are more precise. For example, the statistical differences between the control and experimental groups were not significant versus the differences were insignificant, and many more examples of correct word use. So try to use the correct word use in your writing. Eliminate unnecessarily words. Do not use words that are quantitative and do not add helpful information. In scientific writing, using the words like very, quite, rather, somewhat are very vague and do not really give much information, do not mean anything, and try to get rid of jargon and repetition as much as possible from your writing. Once you submit your paper, don't be afraid. You may get comments back, and we get comments almost in 99% papers back. And those are sometimes they are very constructive comments. And we really take into account and really revise our manuscript accordingly. And we have to perform new experiment. In my experience, that if we responded effectively to each and every comment, we take each comment number 1, 2, 3, 4, reviewer number 1, then reviewer number 2, 1, 2, 3, 4, and comment, response, comment, response. If we do that effectively, most likely your paper will be accepted right away. So don't be frustrated if you get the comments back from the journal. Any questions so far? All right. In the last few minutes, I will be giving you an assignment. And I would like you to pick up a topic to write a small scientific paper. And that scientific paper will be within 3,000 to 4,000 words with 1 or 2 figures or 1 or 2 tables in here. And that needs to be submitted before the next class or maybe by end of the month if you can. Is that okay? The questions are this, and you may come up with some other question related to the NIAID mission. I selected these questions based on the NIAID mission, but you can also come up any questions which is relevant to your own field, which I would like you to write the title, abstract, introduction, and the background. We are not doing experiment here, so you can write like a review article, a small review article on that subject. But definitely mention that what are the gaps in our knowledge and what is not known and what needs to be done and what are the key points. So there are some suggested topics in here, and all these slides will be available on the website. Netley will provide you the link, and you can select a topic and get back to me as soon as possible. And I would like you to really start going and writing this. So the first one is about the allergy triggers or causes. You can just think about that. Another one is any underlying immunological disorder. Examples, any recurrent infection, any immune deficiency, infection as a trigger for disease. And any of those topics, you have to discuss about risk factors, underlying cellular molecular mechanism, discuss patient's immune function in relation to the underlying immunological disorder, current treatment, challenges, outstanding questions, and key points. You can also have a topic related to anaphylaxis or any acute allergic reaction. This is a very important topic, especially for the peanut allergies and other type of allergies, which several children are very sensitive to those, or anybody else who is allergic to pollen and so on and get exposure to those pollen, house dust mite or something like that. You may pick up a topic related to any immunotherapies in a clinical condition. There are so many different types of immunotherapies now being used in various conditions. Just pick up one immunotherapy and discuss about that, what it is used for, what are the adverse effects, what are the outcomes, and then how could it be improved. You may have a topic related to asthma. Asthma is classified into levels based on symptoms and lung function, influence on treatment decisions, and outstanding questions. Other topics which I have come up with, the allergies and asthma. How can you manage the allergies and asthma in a different environment, such as at home, work, or travel? And identifying and controlling environmental triggers is essential. How does autoimmunity arise? Critically review the triggers and mechanisms of autoimmune diseases. Interplay between genetic and environmental factors in autoimmune disease. And then lastly is the bronchial asthma, that talk about in general on bronchial asthma in relation to airway hyperresponsiveness, symptom history, potential triggers, asthma severity, and how do you measure those based on the FEV1 and other things which we do. And then later on, what are the medications and what are the potential side effects and how we can improve in regards to the treatment strategies. So these are the several different classes of examples of the potential topics which I would like you to pick one and send back to me your selection by tomorrow morning, or I will prefer this evening, that what topic you are selecting to write, because this is an assignment under this course and I would like to submit it in next 3 weeks. Is it doable? And if anybody has any question, please feel free to talk to me, come and talk to me in my office. I will be here every day, or we can discuss it on the Zoom. And I can help you, direct you. And once you write the article with all proper references, I will try to submit to a journal. And obviously, you will be the first author of the article. And as I said, you may come up with any other topic related to the NIAID mission in your own area of interest, other than these topics. It is not. It's just a short $3,000-4,000 words article, which I would like you to have 1 or 2 figures, schematic diagrams. You can use the BioRender program. You can have 1 or 2 tables, but talk from a clinical point of view in regards to the risk factors, epidemiology, underlying cellular molecular mechanisms, what are the current treatment strategies, what are the adverse effects of those, and what are the limitations, what are the gaps in our knowledge, and what are the key points on that particular subject. It will really enhance your knowledge and also help you how to write a very good article and as well as have a publication. It's a win-win situation. Any questions for me at this point?
Quick question. Is this different from or is it the same thing as the one review article that we're supposed to write? Like, is this like a building block towards that?
Well, yeah, that's the one given to you about a month or something ago. Have you already done anything on that?
Yes, but I still feel like it still has a ways to go.
Yeah, so I would like, Sijam, I would like you to do something. I know that what was assigned to you, it will be better. This is a separate assignment related to the CTS 713. And I do not recall, I don't remember about what topic I gave to you earlier, because you are working with Dr. Thankam on that article. Is that correct?
Oh no, the one that I'm working on is it was the one that was for this research year. The one with Dr. Tankam was different. That one was just my own.
You think about it, but this is a separate assignment related to CTS 713.
Mhm.
And if your article, you already have done it, I will prefer that you pick another one from this one.
Okay, just because I haven't completed it yet. I just have certain things written up and
If you have not started at all or very little started, then yes, that is a different question.
okay,
It's
okay,
up to you. If you want to achieve more, it's up to you. But
okay.
I would like the article written in an NIAID mission area related to this, because I have to keep that in the record. And if NIH comes back to me, I will tell them that the participants worked on this article.
Sounds good.
All right. Any other question? Was it helpful? All right. So I know it is only about 9:45. We still have some time. I will be happy to answer any other questions you might have, but please come back to me with the selection of your topic as a part of the assignment to CTS 713. And I will tell you upfront that when Dr. Thankam gives the lecture on grant writing, that what are the various components, he will also ask you to give an assignment on grant writing, which will be reviewed. Once you submit it, I will review scientific writing one, and he will review on the grant writing one and gives feedback to you. And if possible, will help you to submit the grant proposal to some organization for funding in your name. In my case, I'll submit your article for publication in a journal. All right. So anybody has any concern, feel free to raise any concern if you have. If not, sounds like you are all in favor of this, and you got all the information and message, and look forward to hearing from you in regards to your selection of the topic and any directions you need from me in writing the article. I'll be happy to guide you and help you. I will prefer that if you submit it to me within the next three weeks or so. Do you think it is doable? Okay. All right. If it takes 4 weeks, doesn't matter, but preferably do it as soon as you can, because then you will be busy by end of July or first week, you will be busy writing your original research article as well with your advisor. If no other question, I wish you all the best for rest of the day. Netley will get back to you about a little bit change in the schedule, and that change will be, Netley, did you already convey to them yet?
Yeah, I already sent them the the surgery dates.
Okay, so Dr. Redwan will be showing the surgery in PACE tomorrow, that is Tuesday and Thursday. Since not everybody could be accommodated in the surgery room, he will be dividing 4 to 5 one day and other people another day, Tuesday and Thursdays. The Tuesday's lecture of Dr. Rai will now be given on Friday. And Dr. Redwan's Thursday's lecture will be given the following Monday. So yeah, Netley will keep you informed with all those. How are the research going? Any concerns on the research? Any questions if I could be of help? If not, then I wish you all the best for rest of the day. Have a blessed day. Bye for now.
Thank you.
Bye.